In today's session, it gives me great pleasure to say that we are joined by my lovely colleague, Rhiannon Daniel, who will be looking at ways in which we can support children with spinal cord injury in school. As well as being a specialist spinal injury solicitor, Rhiannon is also a Level 1 IPSA qualified special educational needs advisor. Now, as Rhiannon is talking, if you do think of any questions, please pop them in the chat and we're going to ask Rhiannon them at the end. So that just leaves me to say over to you, Rhiannon.
Thank you very much. So yes, today I'm talking to you about supporting spinal cord injury children at school. As Victoria explained, I'm a personal injury and clinical negligence solicitor specialising in spinal cord injury claims, and I act for children as part of these claims. And in order to complement the child clients that I act for, I became a Level 1 IPSA qualified special educational needs advisor. So this allows me to work closely with families and schools of my child clients to ensure that their complex needs can be met, which gives clients the best chance to thrive after their injuries. My plan for today is to talk to you about the process that goes through in relation to returning to education, IEPs, EHCPs briefly, and appeals, and where one can go to for further support. I hope to provide some useful information to assist you in getting your clients' patients the educational support they need and to consider the various transition phases. I think at this point, it's imperative to say that children are resilient and a large proportion of their time is spent in education. And with the right support following a major trauma, education doesn't need to be impacted. I will be able to only discuss some of the topics briefly, but nonetheless, hopefully you can implement it within your day-to-day practice. So, as I say, returning to education, sustaining a life-changing injury like a spinal injury can cause individuals to experience many challenges, but education should not be one of them. There is no reason why children with spinal cord injuries should not have a positive education experience and be able to flourish and achieve their goals. It may be daunting for a school or education provider to consider how to include a child or a young person with a spinal cord injury. And it's imperative that parents and caregivers are aware of what support is available so that they can access the correct support during the various stages of education. As Jan Goranowski said in the seminar just before the Easter break, it's a testament to the rehabilitation if a child is able to be discharged and go straight back into school. But I would say to that it's really important that everything is in place to give that a positive experience. So what first? If you think that the child needs extra support in school, what do you do? One of the most important things to do is to collect accurate and useful information about what the child needs in order to be included in school. This could include information about specific medical requirements and subsequent implications on their life at school, e.g. mobility, bladder or bowel management, any medical issues, spasms, autonomic dysreflexia, or what medical treatment they may need to accommodate in the school environment, physiotherapy, OT. First, you need to break down the uncertainty around the subject and broach the subject with the school. Get the headmaster or headmistress into the school to meet with the clinicians. Backup charity have an education inclusion toolkit about education, life and spinal cord injury that you can read through and share with parents and teachers. It's really important that this process happens because not many people will have had this experience. So providing them with the information, helping them to understand, making it a two-way process just sets up the process from the beginning and allows for a more positive experience. Then set up a meeting with the SENCO, get the school's thoughts, share medical reports, therapy, specialist reports, discuss if the child's needs can be met within the school environment. So if you're working within a spinal unit or within a hospital, the reports from clinicians on the ground about what is needed can be really helpful to establishing that. And first of all, consider an individual education and plan and keep it under review with what the child's struggling with, identify goals. And then if they don't make the progress, then you can go on to request the EHC assessment, which I'll go into more detail later on. It is very case specific, and spinal injuries are more complex in terms of getting EHCPs. However, that it's not impossible, and that is a common misconception. In terms of putting this into practice, I have a client who is ambulant. She has a spinal cord injury. She's at secondary school, but they have been able to make changes such as she is in a secondary school, so that she doesn't have to carry backpacks between the lessons. She has multiple sets of books which are within the various classrooms. The timetabling of her lessons are put so that the classrooms are close together. And we heard in one of the earlier webinar series from Ella Beaumont, and she talked about her experiences of PE and what could be done in terms of adjustments made with regards to sport and accessibility. So think about all of these issues and think about the practicalities of everything. So the legal definitions are shown on the screen, and they're outlined in the Children and Families Act 2014. So a special educational need is a learning difficulty or disability which requires special educational provision, and a learning difficulty or disability is significant greater difficulty in learning than peers, or a disability which makes it difficult to use the facilities provided in mainstream schools or colleges. And a special educational provision is education or training additional to or different from that made generally for others of the same age in mainstream. So an educational healthcare plan, people talk about it, but do we really know what it is? It was introduced to replace the Statement of Special Educational Needs, and it's a legal document that describes a child or young person's special educational, health, and social care needs. It sets out the extra help that will be given to that child or young person to meet those needs, and how that will support the child or young person to achieve what they want to do in their life. This may be the only way of accessing the additional specialist provision that is required. But be warned, the process of getting an EHCP is not a quick one, and it can take up to 20 weeks. If you get the EHCP right, that will be the scaffolding around the child, and that in itself will build resilience. So it's really important from the outset that all of these points are considered. The benefits of an EHCP are that it can be provided from support. It can provide support from birth up to the age of 25 years. So commonly we think about education maybe running to 18 or 21. So it's beyond the normal education range we think about. However, it doesn't provide support at university. Special schools or specialist provision within a mainstream school cannot be accessed unless your child has an education and a healthcare plan. And places in mainstream schools will usually be allocated first to children with EHCP plans. The child can get access to treatment that they may not be in a position to access privately. For example, if the child needs it to access the curriculum, that means that it should be funded by the local authority through the EHCP. And the document helps to integrate the support into the school. It provides a holistic approach to the child's needs, which is where they spend so much of their time. And it includes, as I said, social and health aspects of their needs. It's legally binding on the local authority to make the provision in the educational healthcare plan. And the local authority need to prioritise, as I said, the children with EHCPs before other children. And this is very important with budget cuts and as we've seen post-COVID, the difficult times that are being experienced. So an EHCP plan can be a good piece of protection to have in your armour. So the categories of SEN, there's 4 broad categories, which are outlined on the slide: communication and integration, cognition and learning, social, emotional and mental health, and sensory and/or physical needs. Spinal injuries are more complex, bladder, bowel issues, therapy needs, mobility needs. If someone's morning routine takes longer, and that means that they miss the first, let's say, 5 minutes of the school day, that soon adds up. If they're not able to sleep because of pain or spasms, then again, that impacts upon their education. And I think that from my experience, these considerations sometimes are disregarded. So it's important to keep in mind that these categories are broad, and you really need to consider the wider impact on the child. So what kind of special educational provision? Obviously, there's a huge range of special educational provision to meet a specific special educational need. Therapies, OT, PT, SALT, hydrotherapy, music therapy, equipment needs, wheelchairs, one-to-one support, breakout areas. So there's a wide range that can be provided to allow the individual to be able to access the curriculum. Specific examples of needs: mobility. I've had clients who are wheelchair users, but I've also, as I said, have clients who have spinal injuries who walk using orthotics or other mobility aids. And for clients reliant on mobility aids, that means it can take them longer to move between lessons. And as I said, missing 5 minutes of every lesson soon adds up. Again, as I said, the morning routine can become a challenge to children and can delay the start of their school. Sleep can impact upon a child's energy levels, and the child who turns up at school having already done a significant morning routine has already had a long morning, and all of that needs to kind of be made aware of to the local authority and to the school as to the challenges, or the maybe challenges is the wrong word, but what that individual has already gone through before they've even got to the school gate. In relation to bladder and bowels, I've acted for clients who are catheterized, and this is very intimate care. And for younger clients, they often need the assistance of others in a suitable environment, such as an accessible toilet. It also may need to be carried out at very particular times, which may not align with school break times. Inadequate bladder care can lead to bladder infections. And so it's vital that proper consideration is given to this aspect of a child's care. Bowels, it's common for those with spinal cord injury to no longer have control of their bowels. And whilst their bowel regimes aim to minimize the chance of bowel accidents, they do happen. It is something that is simply beyond the control of a spinally injured child. However, if schools have appropriate facilities, such as accessible showering facilities, this can be dealt with on-site, limiting the risk of too much learning time being missed. Therapy needs. Often, children with spinal cord injury will require specialist therapy, for example, physiotherapy or occupational therapy. Whilst this is often completed outside of school hours, it is important that any school understands the importance of this type of therapy and the additional burden it places on a child's free time. Additionally, due to the amount of time that children spend at school, some therapy may need to be completed during the school day, and that may need to be facilitated, for example, a standing frame during a lesson, as well as the need to store any such equipment and to assist any child in using the equipment, for example, in relation to sports. Consideration around the practicalities of just the general environment. For example, the desk or the table, how will they access it? How will they be included within the lesson as a whole? This isn't intended to be an exhaustive list, but hopefully what this does do is make you think about some of those factors that will be taken into account, and to ensure that those are highlighted within documents so that it's aware, because as I say, it's generally a lack of understanding or a lack of knowledge about spinal cord injury and about what that means that it's very hard for the school to understand or appreciate, whereas as practitioners dealing with spinal cord injury clients or patients on a day-to-day basis, it's well known and well versed to you. You know, a school may not have ever had someone who's spinally cord injured before, so never experienced that. And the matters that are obviously being talked about can be very personal and very sensitive topics. In order to get an EHC needs assessment, you need to request it, but you need to find out, do the school support it? If the school support it, then you need to write to the local authority SEND team, and if they won't do it, then you can do it yourself, but it's preferable to have the school support. You need to list the difficulties and all relevant information, therapy reports, if there is a claim, expert reports, and detail why an EHCP is needed. What are the needs? What are the special educational needs? What provision do they need? Therapy, specialist treatment, and make sure that you are in a position to think about maybe getting private reports if that is available. But if you are within a unit, information provided from physios, OTs can be hugely beneficial to help with that assessment, because that can inform the content of the plan. So if it's, I appreciate that it's not always an option financially to have the private reports. And that's where I would say that clinicians on the ground can really assist with an individual's needs. There are some misinformation that people hear about. You don't need an educational psychologist's report. You don't need to show that the school has spent their budget or anything of that nature. So my point on this slide is the importance as clinicians about thinking about how you can support the process for your patient when they are an inpatient, and how you can help provide information that will support that package. So part of the EHCP process is to state the needs and what support is needed. So provide as much information as possible. Consider the specifics of the school environment. London schools, as an example, are old Victorian buildings. Consider accessibility. Consider workarounds. Visit the school and apply your mind to how it will work in practice. This will only help the individual. As Jan Goranovsky said, if an individual is at risk of autonomic dysreflexia, be aware of the issue, but this should not be a barrier. Educate and raise awareness of what this looks like and what needs to be done. If the local authority agree to do an assessment, then they decide after 6 weeks if they will do it. If they do agree, then the local authority will get information from parents, school, social services, and then at 16 weeks, they will make a decision if they will issue the plan or not. And then you'll get a draft plan, which you have 15 days to respond to. So you need to have done your research into placements and your preferences during this period. After 20 weeks, a final plan is issued. I will come on to the appeal process later on, and it may be at this stage that you want to get input from an educational solicitor. It's important to consider the various transitions. So nursery to primary school to secondary school to college. As I said earlier, you can't have an EHCP at university. But the key stages are these transition stages, and there will be annual reviews, and it's important that you can provide information as to what's going on the ground to inform that plan at these annual reviews. So often clients will re-attend spinal units for MDT annual reviews. So it's important that you keep up to date these information, and you always have at the back of your mind what the local authority will be looking at. A transition from primary to secondary school is often a very different environment. You're moving from a small classroom, one classroom, to having to move around throughout a secondary school, to often commuting to that secondary school. So it's important as well to consider that you need the evidence, or preparing the evidence, at least 1 to 2 years before that transition takes place. And planning in the years before ensure that then the individual has a smooth transition and doesn't have any impact on their education. So my tips in relation to the slides that we've just gone through are that you're experts. You deal with this on a day-to-day basis, and you can facilitate learning, education, and it's a holistic approach. If the individual does have a case manager or a representative, it's handy that all communications go through one person, so that the school don't become frustrated by different people communicating with them. And as I said, plan ahead so that you can think about those transition periods, and also be aware of the disability discrimination side of things, and be able to raise it, flag it, and address it. And by doing all of the above, you're creating this resilience and a chance of problems reduce. So as I said, there are annual reviews, and the plan should grow and develop with the child or young person. So it's unlikely that the plan will remain the same for the time. And you have the first review of the plan must be held within 12 months of the plan being finalised, and then it's generally every 12 months thereafter. And it's a formal process, so the local authority should be gathering information before the annual review and circulating it. They have an annual review meeting with parents, and they must notify the local authority must notify the parent or the child of the young person within 4 weeks of the meeting. I would recommend that individuals are prepared for this. Don't leave it up to the local authority. If there are big changes in a child's needs, a deterioration, or if they've gone from being able to mobilise with the use of mobility aids to then becoming more reliant on a wheelchair, get this information, get it evidenced, get as treating clinicians the information there, talk to the school about the struggles, take video evidence, show any change or new needs. And I reiterate that this is even more important within those transition periods from the various stages of education. What happens if something changes whilst you're within that 1 year period? You don't have to wait until your annual review. You can ask at any time, as long as you have a good reason. Examples of a good reason are that the needs have changed and they no longer are as accurately described, or that it's no longer meeting the child's needs. So to recap, we've discussed what an EHCP is, we've discussed the benefits of having one, and we've discussed how you request an EHCP needs assessment. But unfortunately, it might be necessary to challenge decisions made by the local authority at various points on the child's educational journey. So what can you appeal? As it says on the slide, you can appeal the refusal to carry out an EHCP needs assessment, to issue following an assessment, to reassess the needs, to amend following review or reassessment, to maintain, and the final version of the plan. Although an appeal may seem daunting, you should not be put off appealing. Often children who have spinal injuries are rejected on the basis that they just have a physical disability rather than learning difficulties. However, the legislation is clear that physical disabilities are covered, and as detailed above, the needs of a child with a spinal injury are often complex, and local authorities may well need to be educated about the impact a spinal cord injury can have. Disputes, and just to put this into context, disputes heard at the appeals stage have more than doubled since 2015. And in 2020, 92% of appeals were found in favour of the child or young person. Therefore, it really isn't an avenue that should be readily dismissed. Deadlines. So the tribunal must receive the appeal within 2 months of the date of the letter advising of the right of appeal, or 1 month from the date of the mediation certificate, if later. If you miss this deadline, you can ask the judge to extend the time for making the appeal, but you really don't want to be in that position. And I'll come on to talk about sources of support during appeals if you don't have legal representation. So, in summary, communicate with education providers, consider timescales. The process of an EHCP can take up to 20 weeks and an hour, even longer if appeals are needed. So when you're in the clinical setting and looking and working towards discharge, have this in mind. You know, it's not something that takes place overnight. Consider the evidence that will be required to demonstrate the needs and consider seeking specialist advice. And as I said, don't be afraid to appeal a decision. And taking into account all of that, parents, children, and education settings can then work together to ensure the individual reaches their potential and resilience can be built. There are many charities and many organisations that can provide support to individuals. I would say that I've only selected a few here. And these charities are IPSA, which is the independent provider of specialist education advice. As I mentioned earlier in the talk, Backup has a educational toolkit, which is very useful to be passed to schools to help them understand. Willpower also have various educational kits on educating clinicians and sport. And relating back to Ella Beaumont's webinar earlier in the series, she also mentioned about a BBC documentary, I think, coming out on Channel 4 about getting people back into PE and sport. So there's obviously wider resources available that are out there. That is my whistle-stop tour of how to support children at school with spinal cord injuries. If there are any questions, then I would be happy to take them.
We do have one question in the chat, Rhiannon. Is EHCP UK-wide or England only?
It's definitely England and Wales. And I am not aware. I don't know about the provisions under Scotland and Ireland, I'm afraid.
No, my understanding is Scotland don't actually have an equivalent. It's very much done on a school by school basis.
So I think it would be the individual. You would be looking there to work under the individual, the IEP, individual educational provision. Mm-hmm. But you could probably use all of these resources to be able to make sure that they're aware of the needs and look to kind of inform and implement their practice.
And a question that I had for you relates to the issue of like costs of bringing appeals, because obviously, as you said, the percentage chances of success are quite high. So, you know, it's worth doing it. But if, as a private individual, if you incur costs, if you instruct a solicitor, or if you go and you get private reports, are people going to get those costs back if they're successful?
Yeah, well, you can. That's something that people are petitioning to try and change the law on. It's a very difficult area, and it's I don't think there's anything in the provisions that you're guaranteed to get those costs back.
Which doesn't, it makes it hard.
It makes it very hard, and it's an injustice that you know, you have to take it to the appeal process and you have to get that information there, which is why I think that if you can counter that by preparing your case for the submission at the earliest possible opportunity with clinicians' information to try and avoid that process, you're just putting the individual in the best possible position, because without that information, I think sometimes it's just the lack of understanding or just the lack of knowledge in relation to what having a spinal cord injury involves.
We do have another question. Is there anything that can be done if a child has to attend a special school despite only having physical disabilities? So they aren't being challenged at the same level they would be in mainstream.
I mean, my answer to that is, well, probably I'd need to know a bit more about the case, because why weren't they accepted within a mainstream school? Because they should, if they have an EHCP plan in place, they should be able to potentially be educated within a mainstream school. So if they're within a specialist school due to the high level of care needs, okay. Again, I'd question why that can't be facilitated within a mainstream school environment. And if that has been obviously properly assessed and considered, then everyone has the right to the same education. So it's whether the EHCP plan can include things, for example, like additional support by way of tutoring within that school environment, especially if there's evidence that they're not being challenged to the same way that they would in a mainstream school. So I hope that answers the question. But individuals with quite significant high care needs, I have seen challenge a decision and been schooled within mainstream environments.
Thank you, Rhiannon. I know you mentioned the webinar that we did with Ella Beaumont, but we also did a webinar with Ella's mum, Kathy, and another parent, Lee. And they were dealing with the parents' perspective. And your talk today actually dovetails really beautifully with their experiences. Lee, in that webinar, which is going to be available online for people to see if they haven't, he talks about the challenges that he faced getting all of the support that he needed for his son. And I don't think it should be underestimated how much pressure this puts on parents who are already facing just really challenging day-to-day lives. Lee highlighted that often as a family they suffer from sleep deprivation because his son's care needs mean that they have to get up in the night. Do you have any advice to parents to sort of help find that resilience, sort of have the wherewithal to deal with this?
Yeah, and I think the peer support services that are provided through the various charities, Spinal Injuries Association, Backup, have not only someone that can talk to the individual, but often also the parents. And I think as well, like, it's very good to find someone within your local authority area, because the battles faced by some local authorities are obviously different to others. So finding that peer support and liaising with other parents who have gone through it, maybe, or are going through it, can help build the resilience, because I agree, it is a fight, it is a battle. You know, you look at the statistics, 90% of people have to, 90% of appeals are successful.
But
But
that's only the people that actually
there's
find it in them to appeal, because there will be a certain level that just can't face it.
Some people will completely get their response and say, okay, only has a physical disability, not a mental or cognitive disability. I can't do anything about that. And I'm not here to say that's right or wrong, but it doesn't rest well with me. And I think that the importance is about letting individuals know what their options are, raising awareness. The more people talk about it, the more then people can log on to look at the charitable sites and look at those various pages, so that you're setting the individual up in the best possible way to be able to kind of deal with these issues.
I think, as you said in your discussion, often some schools, this will be the first, that child that arrives, that'll be the first child that they may have actually had to make these adjustments to consider it. And Lee and Kathy, when they spoke, they talked about how important it was to develop those good relationships with the school, so that when maybe things weren't going okay, or maybe the wrong decision wasn't made, Kathy has a great example about the way in which they included Ella in a sports day to begin with, that she felt comfortable enough to go to the school and say, thank you for trying, but actually you didn't actually quite hit the mark there.
Yeah, that's totally right. And it's not something that they will have dealt with day in, day out. It's, with the best will in the world, they may make mistakes and they may think that they're trying to include, but actually it has the adverse effect. Or understanding that, last week, yes, that person could have maybe done it because they had a good night's sleep, they hadn't had a bowel accident, but the next day or the next week is a different situation, because they've been up all night with pain, they've had spasms, and therefore the adaptation or the approach that was taken doesn't work, because it's not a consistent, not every day is the same, and it's raising that awareness.
And that in part is why you and I are both so passionate about doing these types of webinars, because, if we can increase awareness of some of these issues, then hopefully it will make the world a slightly better place. We haven't had any more questions, so I think we will call it a day. Thank you so much, Rhiannon, for your presentation. It was so informative. Everybody, please join us next week, where we are going to be joined by an OT and a physio, and we will be looking at therapy considerations for children with spinal cord injury. So we look forward to seeing you then. Goodbye.